Documentary, The Impact of Floods in India, is a project presented by Sujal Rai, Thaman, and Vishu Rao, students of computer science and engineering with a specialization in artificial intelligence and machine learning at Lovely Professional University. The Deluge and the Disease, a comprehensive analysis of the public health impacts of flooding in India. Executive summary: floods are the most frequent, widespread, and destructive natural disaster in India, posing a profound and escalating threat to public health. This report provides a comprehensive analysis of the multifaceted health impacts of flooding across the nation, synthesizing evidence from hydroclimatological data, epidemiological studies, public health reports, and governmental guidelines. The analysis reveals that floods act as a powerful multiplier of public health crises, initiating a cascade of consequences that range from immediate mortality and trauma to long-term infectious disease outbreaks, psychological distress, and the exacerbation of chronic health conditions. The hydroepidemiological landscape of India is characterized by a confluence of intense monsoon rainfall, unique geographical vulnerabilities, and accelerating anthropogenic pressures such as unplanned urbanization and climate change. These factors have led to an increase in the frequency and intensity of diverse flood types, including riverine, urban, and flash floods, each presenting a unique profile of health risks. Between 1980 and 2017, floods in India resulted in over 126,000 deaths and affected nearly 2 billion people, with economic losses exceeding $58 billion. The immediate health consequences constitute the first wave of crisis, marked by high rates of drowning, traumatic injuries, electrocution, and a surge in snake bites as ecosystems are disrupted. This is swiftly followed by a second, more sustained wave of communicable disease outbreaks. The contamination of water sources is a primary driver, leading to widespread epidemics of waterborne illnesses such as acute diarrheal disease, cholera, typhoid, leptospirosis, and hepatitis. Concurrently, stagnant floodwaters create vast breeding grounds for vectors, fueling outbreaks of malaria, dengue, and chikungunya. Overcrowded and unsanitary conditions in temporary shelters further precipitate the spread of acute respiratory infections and dermatological diseases. Beyond the acute phase, floods inflict deep and persistent long-term health damage. The psychological trauma experienced by survivors manifests in alarmingly high rates of post-traumatic stress disorder, PTSD, anxiety, and depression, with prevalence rates in some affected populations exceeding 40%. A critical and often overlooked consequence is the severe disruption to the management of non-communicable diseases, as patients with conditions like diabetes and hypertension are cut off from essential medicines and care, leading to preventable complications and mortality. Furthermore, the destruction of agriculture and livelihoods triggers food insecurity, resulting in a measurable increase in child malnutrition, particularly chronic stunting, which has irreversible consequences for a child's cognitive and physical development. These health burdens are not distributed equally. Vulnerable populations, including women, children, the elderly, and economically disadvantaged communities, disproportionately bear the brunt of the impact. Pre-existing social and economic inequalities are amplified, leading to higher mortality rates, increased exposure to violence, and greater barriers to accessing relief and healthcare. While India has established a national framework for disaster management, including guidelines from the National Disaster Management Authority, NDMA, and the Ministry of Health and Family Welfare, MOHFW, significant gaps remain in implementation, surveillance, and the integration of public health priorities into the broader disaster response. The traditional focus on communicable diseases has left the system ill-prepared to manage the growing burden of NCDs and the profound mental health needs of affected populations. This report concludes with a set of strategic recommendations aimed at building a more climate-resilient public health framework. Floods are a big health problem in India. Floods are the most common and destructive natural disaster in India, and they are a major threat to people's health. This documentary, The Impact of Floods in India, is a project presented by Sujal Rai, Thaman, and Vishu Rao, students of computer science and engineering with a specialization in artificial intelligence and machine learning at lovely professional university.